Sedimentation rate, ESR. Red blood cells, RBCs, usually stay apart because they have a natural negative charge. During inflammation, proteins like fibrinogen coat the RBCs. This coating causes the RBCs to stick together and form heavier clusters. These clusters fall faster in a test tube, which increases the ESR. ESR is a nonspecific test for inflammation. It is often used with C-reactive protein, CRP, which is a more specific marker. USMLE style question 1. A 56-year-old man with suspected polymyalgia rheumatica has lab work done. His erythrocyte sedimentation rate, ESR, is elevated. What is the most likely reason for this increase? A. Increased hemoglobin synthesis. B. Decreased blood viscosity. C. Loss of red blood cells surface charge. D. Coating of red blood cells with acute phase proteins. E. Overproduction of erythropoietin. Correct answer. D. Coating of red blood cells with acute phase proteins. Explanation: inflammation causes proteins like fibrinogen to coat RBCs, leading them to clump together and settle faster in the test tube, raising the ESR. Why not the others? A. Incorrect. Hemoglobin production does not affect ESR. B. Incorrect. Viscosity is not the main factor affecting ESR. C. Incorrect. Surface charge is reduced, but the key mechanism is the coating by proteins. E. Incorrect. Erythropoietin increases RBC production, but does not directly influence ESR. USMLE style question 2. Which of the following best explains why erythrocyte sedimentation rate, ESR, increases during inflammation? A. Enhanced oxygen carrying capacity of red blood cells. B. Aggregation of red cells due to increased plasma fibrinogen. C. Increased red blood cell membrane fluidity. D. Reduced production of albumin E. Destruction of red blood cells in the spleen. Correct answer B. Aggregation of red cells due to increased plasma fibrinogen. Explanation: during inflammation, fibrinogen and other acute phase proteins increase and bind to RBCs, causing them to stick together and settle faster, increasing the ESR. Why not the others? A. Incorrect. Oxygen carrying capacity is unrelated to ESR. C. Incorrect. Membrane fluidity does not influence sedimentation rate. D. Incorrect. Albumin levels drop during inflammation but are not the main cause of RBC clumping. E. Incorrect. RBC destruction would lead to anemia, not increased ESR.